Introducing Prevymis Letermovir, a novel therapy for prophylaxis of CMV reactivation and disease in adult CMV seropositive allogeneic HSCT recipients. Distinct from DNA polymerase inhibitors, Prevymis acts through a novel mechanism of action that is virally specific and has no activity against human host cells. Prevymis targets the CMV DNA terminase complex, which prevents viral replication. Due to its distinct mechanism, Prevymis is not likely to exhibit cross-resistance with other antiviral drugs. Management of CMV is important in the adult seropositive allogeneic HSCT patient. CMV infection occurs after allogeneic HSCT in approximately 60% to 80% of CMV seropositive patients who do not receive CMV prophylaxis. HSCT patients with any positive viremia had 2.6 times greater risk of overall mortality than patients with no viremia up to 60 days post-transplant. In a randomized, double-blind, placebo-controlled Phase 3 study, prophylaxis with Prevymis administered up to day 100 post-transplant demonstrated superior efficacy over placebo. At week 24, 37.5% of patients in the Prevymis group versus 60.6% of patients in the placebo group met the primary endpoint, which consists of patients who developed a clinically significant CMV infection, had discontinued from the study prior to week 24, or were missing an outcome at week 24. A similar proportion of patients who discontinued before week 24 or were missing an outcome at week 24 occurred in both groups. The treatment difference was driven by clinically significant CMV infection, which occurred in 17.5% in the Prevymis group versus 41.8% in the placebo group. Efficacy consistently favored Prevymis across all R-positive patient subgroups. Examining the efficacy of Prevymis further, an exploratory endpoint analysis demonstrated the cumulative rates of all-cause mortality to be significantly lower for Prevymis versus placebo at week 24, with continued separation through week 48 post-transplant. Prevymis was also well tolerated. The most common drug-related adverse reactions that occurred more frequently than placebo were nausea, diarrhea, and vomiting. Prophylaxis with Prevymis may be started before or after engraftment. There were no differences in the incidence of or time to engraftment between the Prevymis and placebo groups. The median time to engraftment was comparable in the Prevymis group and placebo group, with 19 days versus 18 days respectively. 37% of patients were engrafted at baseline. Starting Prevymis early post-transplant may be beneficial since more than 30% of HSCT patients had CMV infection within 1 month post-transplant. CMV reactivation can occur as early as the day of transplant. Start Prevymis prophylaxis as early as day 0 and no later than day 28 post-transplant. And continue once daily, oral or IV, through 100 days post-transplant. Prophylaxis with Prevymis beyond 100 days post-transplant may be of benefit in some patients at high risk for late CMV reactivation. The safety and efficacy of Prevymis for longer than 100 days has not been studied in clinical trials. Use of Prevymis for greater than 100 days requires careful assessment of the benefit-risk balance. Provide a path of protection from the start with Prevymis.